you see that? When it's black and not gray, that means it's recording. Okay? So if it's not there, then you know that I forgot to start recording. Okie doke. So we are going to get into the actual anatomy material today. Feel free to ask as many questions as you want. All right, so last time basically what we did is just said, okay, here's the intro to how we approach anatomy, and now we're actually going to get into the terminology. For those of you who already had lab, you probably talked about a lot of this in lab. Why do I do it when they also do it in lab? First of all, always trying to reinforce each with the other, and second, a lot of people miss the first couple classes, so you don't want to dive in and have people completely lost. So, all right, so let's start on the gross anatomy introduction and say, okay, so one of the things that's super important about anatomy is that if I were an American anatomy researcher who was trying to communicate with a Japanese surgeon about a technique or a process or a discovery, we need to have a common set of assumptions because my anatomy is not dramatically different than Japanese anatomy, right? Or Kenyan anatomy, or anywhere else in the world, right? So we need a common set of assumptions, we need a common set of techniques, and the first thing is that we need to assume that we are always talking about the human body with the same assumption, and the same assumption is that the human body is in what we call anatomic or anatomical position, okay? An anatomic or anatomical position means I don't care how I am, what body position I am in, this portion of my body is always going to be, for instance, anterior, regardless of whether it's actually facing the front or I'm top, face up or face down. So anatomical position. If I'm standing, anatomical position is feet on the ground, feet forward, palms forward. Not because this is comfortable or even intuitive, but for reasons I'll explain to you in just a second. So that means that these are all anterior structures. If I were talking to the Japanese surgeon about anterior musculature, it doesn't matter what position the patient is, this is still anterior. Does that make sense to you guys? So likewise, even though it's counterintuitive, my palm is an anterior structure. Yes? Okay, my palm is an anterior structure. I'll explain to you why that is in just a second. So standing, feet on the ground, palms forward, but of course not all patients are going to be standing up, right? A lot of them are going to be laying down. There's two different anatomical positions that still have the same set of assumptions when you're laying down. You can be laying down face up, yes? Laying down face up, that's called supine. But regardless, this is still anterior and this is still posterior, even if I change my body position, right? That makes sense? And if you're laying face down, because you can't get to everything from the front side, right? You're laying face down, that is called prone, okay? Supine and prone. When I was in 7th grade, we learned if you're supine, you can drink some soup with your palms up. And if you're prone, you poe it out, which makes a lot of sense when you're a redneck, because you do poe stuff out, right? So you poed it out, okay? So that is anatomical position. Now, why? Why is this counterintuitive position considered anatomical position? Well, because even though we're studying human anatomy, it's really just vertebrate anatomy, mammalian anatomy. You're really not that different from your cat or your dog. As a matter of fact, human anatomy, we're actually kind of the exception and not the rule. I want you to understand that I have the same muscles here that she has there, and that my dog, who's a golden retriever called Superfly has right here as well. But we are the exception because we are bipedal, right? We stand on 2 feet. But most mammals are what? They're quadrupeds. Okay, so, but here's the deal. I don't have different muscles here than my dog has. I just have to find the muscles that correspond to the ones my dog has. So here's the deal. With dogs, anatomical position, of course, is in all fours, right? So what I want you to understand is that the muscles that are here on a dog, do those correspond to his belly side or his back side? Belly side, right? They're on the same side of his body as his belly. That makes sense? So with humans, to make that work, instead of standing like this, to try to find the anterior musculature that corresponds to the belly, we have to do it like this, right? So the muscles that my dog has right there, right, I have right here, okay? So anatomical position is because humans are weird. Our anatomical position should really be this, right? But it takes up a lot of room in the textbook, so we do it this way, okay? posterior. Now that can be kind of confusing, especially when you're dealing with, for instance, cadavers or patients, and they don't keep their arms like that, right? But, so when you're dealing with cadavers, right, and these are the hardest damn muscles in the whole body, they are called the damn forearm muscles when you're in my class, because they're hard, okay? These muscles, first off, they're hard because there's like 25 of them and they're all like that wide. It's ridiculous. I just hate it, and I have to teach myself every semester because they just don't stick. So these muscles right here, well, the cadavers don't usually preserve like this because that's not how people lay, right? They preserve kind of like that, sometimes like this. Or if there was a viewing before, the cadaver would preserve like this, right? Okay. But you still have to find the forearm muscles. So sometimes you just basically have to logic your way through it, right? So I need to find the inner surface of the elbow, and I need to find the inner surface of the wrist, and I know the muscles that are between there are considered the anterior forearm muscles. They're going to be the same muscles regardless. You're just going to have to sort of understand where to look for them. Does that make sense to you? Okay, so that's an anatomic position with humans and with quadrupeds. Now, the other thing is that because we are not only bipedal organisms, we also have what's called bilateral symmetry. And bilateral symmetry means that you could draw an imaginary midline, right? And there would be mirror image structures on the left and the right, at least externally, not internally necessarily, right? You don't have two livers or anything. But they're mirror image. So we basically have an imaginary midline that we could use, right? And because we have an imaginary midline and because we have paired structures, we are responsible for left and right. Yes? And left and right is super duper important. Left and right is also really important that you understand that nobody cares about your left and right. You care about the patient, the specimen, the cadaver, the organ, you care about that. So what often happens in anatomy lab, and you will see it, is that people are trying to figure out whether that is the right or left deltoid tuberosity, and they're looking at it, and I know. They're like physically flipping their body around so that they can actually get it. And it's okay. Like, nobody looks cool taking an anatomy lab anyway, and all you want to do is get the best grade possible. You ain't going to look good. So flip around, try to figure out. Your left and right always refer to the specimen, the cadaver, the patient. They never refer to you. So do whatever you can to figure out which left and right you're talking about. And here's the important thing, is that if a structure is paired, can you see that saying I is not specific enough to avoid massive medical malpractice? You have to talk about the right eye, don't you? You have to talk about the left lung. And why? Just to torture you? No, because you've read all the damn articles, right, about people getting the wrong knee operated on, the wrong kidney taken out. How does that happen? It happens with bad habits that start right here. So here's how I will encourage good habits. At some point this semester, I'm going to count off the entire question, because instead of right lung, you put lung. I probably will only have to do it once to you, okay? Because if there is a paired structure, leaving off left or right is wrong. And if you got away with it, you're not going to do it every time. Now you've seen it, right? What do they do now in surgical situations in which, like, I'm going to have my knee operated on? What do they do?
Sure.
Yeah, you have to write it, and then they write it, right? And why do you think you have to write it? And then you have to initial it too, because they're trying to keep from getting sued. Yeah, I had a friend who had surgery on his right knee this summer, and he's just adorable and hilarious. And he, of course, they're like, left him with the Sharpie, and they're like, mark your knee. Well, he's bored. So he writes this one, and then he writes, not this one. And he pulls down, writes around his junk, pull these back up, writes on the back, turn me over. That was the funniest damn thing. His surge tech said that they spent 10 minutes laughing. So thanks, you knocked off the surgery schedule. Okay, so that's the basics. Anatomic position. And now we are going to talk about these. They're called directional and regional terms, and most of them are easy because you've been a human who reads things for a while, but some of them are a little less familiar. So these are called directional or regional terms. Hold on just a second. And the directional or regional terms start out with, so if I'm describing two structures with reference to one another, I can use these terms to describe them. The top ones are really easy, superior and inferior. So if I'm describing two structures first, anatomical position is always assumed, yes? Okay. So my nose is wet to my navel. Yeah, right? But my navel is wet to my nose. Inferior, right? Okay. So those who've been in person for a while, those are fine to use. I want to tell you though that although those work for humans, they don't work for Superfly. They don't work for my dog. They don't work for your cat. So sometimes you need to use a term that's more consistent between species and despite body position. So is that true for your dog or your cat that his nose is superior to his navel? No, it's not superior, right? But I could use a set of terms that was really consistent, and those are called cranial and caudal. And they're similar, but not exactly the same. Cranial means more toward the head. Caudal means more toward the tail. Couldn't we use those terms? And they wouldn't change between me and my dog, right? They wouldn't change at all. So which one do you use? Yes. Whichever one the textbook uses, right? And they will get comfortable with some in some situations and others in other situations, right? So superior and inferior, cranial and caudal. So let's do cranial and caudal. My chin is wet to my pelvis. Cranial, right? And my pelvis is wet to my chin. Caudal, exactly. Does that make sense? Okay. All right. So those are all right. Anterior, posterior. Yeah, you've been conscious for a while. I'm sure you understand what those are related to. Anterior and posterior is assuming anatomical position, right? So everything this side, regardless of my body position, is considered an anterior structure. Go ahead.
Sorry, can you use can you say when you would use cranial and caudal instead of superior?
It's not really an instead of. It's really people have one preference versus the other. Yes. Although cranial and caudal, I think, is actually better. I still think superior and inferior is used more frequently. Yeah. But there's when we get to dorsal and ventral, that one's actually used more frequently than anterior and posterior. So it's really kind of based on people's past, just what they got used to. So it's not like a specific thing.
One more question.
Yeah,
that,
sure.
Because like in the book, it was saying like the shoulder is cranial to the foot or something like that. And I was like, okay, well that can be like anything above could be cranial then?
Yes. Anything more toward the head is considered cranial, and anything more toward the feet or tail is considered caudal. But I usually, when I use cranial and caudal, try to make sure it's from here to here, because otherwise toward the tail is a little confusing.
Yeah.
So I just have to be good at writing those questions so I don't mislead you. So I am pretty good at writing the questions because I've screwed it up enough and fixed them. Okay, so anterior and posterior is pretty obvious, right? So my nose is a what structure with that pair? Anterior structure. And my the spinous processes of my vertebra are posterior structures, right? So that's all right. But anterior, posterior doesn't really work for, again, my dog, right? So it's not true. Nose and the spinous processes of the vertebra wouldn't be described the same way. So let's use a set of terms that's really consistent and it's really commonly used related to his question. Dorsal and ventral, okay? Ventral means belly side. If I'm in anatomical position, that my umbilicus is a ventral structure, my eyes are ventral structures, my toes are ventral structures, right? How about my palms of my hands? Those are ventral structures as well, right? So if I looked in a textbook, and I quite often would, I would see left forearm, comma, ventral view. And I would know I was looking at this part, right? And don't think it's super easy to tell which side you're looking at once you get the skin off, because it ain't. Once you get the skin off, it's like, I don't know what the hell's going on there. So understanding what the label means is really useful. So this is ventral. All of these structures are dorsal, right? So the gluteus maximus would be dorsal, right? They're actually considered dorsal thigh muscles because they move the thigh, right? My coccyx would be a dorsal structure. The back of my head would be a dorsal structure. And for those of you who fish, where's the dorsal fin? It's on the backside, yeah. So that's where the dorsal fin is. So dorsal is backside. And do you see that dorsal and ventral are consistent between species, right? So the umbilicus of the dog, do you know your dog has a belly button, right? Your dog has a belly button, you gotta look around for it, you might not like it, right? Every mammal except marsupials has belly button, which is just the coolest thing. I really, really want to look at a duckbill platypus belly now. I totally do. I want to look for his belly button. It's not going to happen. Okay, so these structures are all consistent between me and every other mammal, right? Dorsal and ventral. And they're really, really commonly used. So get used to dorsal and ventral. Okay. All right. So medial and lateral and intermediate. I think I forgot to do these in the last class. I'll have to come back and do that. Okay. So these are not bad. So if I am describing structures with reference to the midline, further or closer away from the midline, they will be medial, lateral, or intermediate. Okay, so let's do the whole body first and say, okay, I have an appendix scar right here. That appendix scar is what to my navel? Lateral, right? And my navel is what to my appendix scar? Medial. If I had a mole right here, it would be intermediate between these two, right? So lateral means more toward the outside, away from the midline, right? Medial is toward the midline. Good? But don't let this confuse you. But it's not just for the whole body, it's also, for instance, for a limb. Okay? Where would I find the lateral muscles of the thigh? Yep, where would I find the medial muscles of the thigh? Yes, that's where I would find them, right? Does that make sense? Okay. So, for instance, this is lateral for the arm, for the forearm, and this is medial for the forearm. So it's not just the whole body, right? It's medial. So if you imagine an imaginary midline down whatever you're looking at, like medial is like going toward the middle of the body related to that, right? And lateral is going toward the outside of the body. Is that okay? Okay. And then intermediate would be between those. Okay. Proximal and distal, this is the one that gives people the most trouble, but if you listen today, you will totally get it. It's just a little less familiar to most people. So what is proximal and distal related to? Proximal and distal is for long, skinny things like limbs or tubes. Now, we use it a ton for tubes, but you guys aren't super familiar with the anatomy of the tubes inside yet, right? So let's start with the limbs, yes? Proximal and distal is used to describe things along the length of limbs or tubes, okay? Because limbs or tubes are not always in the same position from one person to the next. So let me give you an example of why you would use this. If I had an intestinal blockage, right, and I find it, but then I send you to a specialist, is it going to be, are your organs going to be in exactly the same position the next time, right? So I couldn't use anterior, posterior, lateral, and medial and have it meaningful, but it would probably be along the same portion of the tube. So I use instead proximal and distal. Proximal means closer to the point of attachment, and distal means further away from it. So let's do limbs because they're easy first, okay? So my elbow is what to my wrist? Proximal to, but my wrist is what to my elbow? Distal to, yes? Okay. So I don't use superior and inferior for limbs or tubes, it's wrong, right? You use proximal and distal. So let's do it on the leg, or the thigh and the leg. My ankle is what to my hip? Distal. My knee is what to my ankle? Proximal, right? So these, the point of attachment is kind of, obvious, right? Sometimes internally it isn't obvious, but we'll have to tell you the point of attachment. So with that whole intestinal blockage thing, maybe I would have to be really specific about what I was talking about. I think the location of this blockage is 10 centimeters distal from the pyloric sphincter, right? And I might have to say, because there's two sphincters, right? I might have to say which one I'm talking about. Which one do I choose? Well, probably the one that's closest, right? Okay. And then how do I choose whether it's proximal or distal? Well, usually with your anatomical knowledge, you go the direction that the food was going or the blood was going, right? Does that make sense? Okay. I won't make you guys do that at this point. I'm just telling you that that's the usage. But you should be able to do limbs at this point. Good? So that's proximal and distal. And then the last one is superficial and deep. And superficial and deep is easy if you think about wounds or personalities, but mostly wounds. Okay. Superficial and deep, if you imagine yourself as a squishy ball, right? If you have a wound and it doesn't damage much of the surface, then it's superficial, right? If it goes really, really far in, then it's going to be deep, okay? But we don't just use it for wounds. We also use it because things are layered in the body. You may or may not know this, but the abdominal muscles have a bunch of layers on top of one another. So how do you describe them? Well, let's think about a thing that you are familiar with. You don't know abdominal muscles yet. You know skin, muscles, and bones, right? Okay. Superficial means on top of or closer to the surface. Deep means deeper, right? So you guys tell me, what's the relationship of bone to muscle? Bone is blank to muscle. Deep to muscle. And what is the relationship of skin to muscle? Superficial to, right? So a lot of times when you get into like the abdominal muscles or the thigh muscles, there's several layers. And so you're going to know that this one is superficial and that one is deep, right? That makes sense? So that's part of how you will learn musculature. You can't see everything from the top layer. Okay, so the other one, and you're going to do this on your own because it's really just not a good use of class time. Same ones that you have to learn for lab, right? There are specific terms for each region of your body, and they end up being used over and over. So this seems arbitrary right now, but I'm promising you that it's not going to be. So for instance, some of them, like you're probably not going to be surprised that this is gluteal, right? Okay, but you probably didn't know that the back of the elbow is olecranon. And why the hell do you care? Well, because later on you're going to learn the olecranon process in the olecranon fossa, and you're not going to look for them in the knee, are you? Okay. You may or may not know that brachial means arm, but that will help you when you start looking for the brachiocephalic vein, because it goes between the arm and the head. Does that make sense to you? So this seems like not a good use of your time, but I promise you it is, because when you know antecubital means the anterior portion of your elbow, you will know exactly where to look for. We just did these terms today, the medial antecubital vein, which is common side blood vessels, right? So this is your assignment, both for lecture and lab, is to get all of these terms. It's part of what's going to be on your first quiz as well. Well, second quiz. First quiz is syllabus, but your take-home quiz. But it's going to be open book, right? But you're going to have to actually start learning it. So this is a good use of your time. Those of you who actually get it out of the way will benefit from it all semester long. Those of you who don't will regret your decisions. Okay, so now axial and appendicular, this is just two like these general terms that you'll sort of see repeated all semester long. They're more general than that list that we just looked at. Okay, so what is axial and appendicular, and why do you care? Well, because we're going to be doing, starting next week, 1 week on axial skeleton, and then 1 week on appendicular skeleton, and then 1 week on appendicular muscle, and 1 week on axial muscle. So what do these have to do with? These are like big picture terms. Axial has to do with the long axis of the body. So if you imagine me sticking an eye bolt in my head, right, and hanging myself from the ceiling, there's a certain place where I could hang myself where I would be relatively stable, right? That is the long axis of my body, right, wherever that is, right? Okay, and all of the bones and musculature associated with that would be considered axial. So for instance, does it surprise you that the cranial and facial bones are axial skeleton, right? How about the vertebra? Also axial skeleton. And then things that are directly attached to the vertebra, like the rib, those will also be considered axial. Good? Okay. Now, appendicular as in appendages. Yes? Appendages. So if you were doing appendicular skeleton, you would say, okay, I've got the appendicular skeleton, which of course is going to include all of the bones of my hands, my wrist, my forearm, and my arm, right? And that's obvious. What might be a little counterintuitive is it's also any structure that is there to hold on to your appendages. So the clavicle and the scapula, those are only there to hold on to your arms. So those are actually considered appendicular musculature. I'm sorry, appendicular skeleton. Good? Same thing with my hip bones. I don't need those if I don't have legs. So obviously this is appendicular skeleton, but so is this. Good? And every once in a while it'll be counterintuitive. Please understand that I understand this class is difficult enough. I am not trying to find a reason to make you get things wrong, except on bonus questions. Then I am. Not really. No, with bonus questions, I just try to like hit you from left field and see how you think on the fly, because it's really entertaining to see how you do it. So it'll usually be a little less familiar. You have to like step out on the ledge a little bit, but it doesn't hurt you, right? Like make me laugh. Bring up something that I didn't know. You'll probably get a point or two. But sometimes it'll be kind of counterintuitive, like this, right? So initially with that description, you would probably think that the pectoralis muscles, pectoralis major, for instance, you would initially think, oh, that's probably axial because it's associated with the trunk. But what's its function? What do your pecs do? Yeah, they move your arms, right? Okay. So although that's kind of counterintuitive, they would actually be considered appendicular. Now, I don't nitpick you about that, but what I'm saying is when you run into something and you're like, why the hell is this in the appendicular list? It's because of functionality. Does that make sense? Like the deltoid muscle right here, although it starts here and ends here, it does this. So where do you think it goes? Yeah, it goes with appendicular. Good? Okay, so we don't do that yet. I'm just telling you for later when you start looking at the list and you're like, WTF, that's why. Okay, so now let's do body planes and sections. Okay, so with body planes and sections, basically, because you can't see everything from the outside, you often have to make cuts. And there are names for those kinds of cuts. Okay, sometimes you don't have to make them physically. Sometimes you can actually make them with imaging software. But regardless, to look inside, either you make a slice or you pretend that you made a slice. So these planes are going to produce sections. So first thing I want you to understand is that I want you to understand that a plane, think about a really, really sharp, thin piece of glass, right? And we will use a plane to make a section. The section is the cut edge, otherwise you wouldn't have cut it there. That's what you're interested in looking at. Yes? Okay, so for instance, a sagittal plane produces a sagittal section, and then you look at a sagittal section under the microscope. Good? Okay, so let's talk about the categories of planes and sections. First ones are, there are what's called longitudinal or vertical planes, and those planes are parallel to the long axis of my body, yeah? But the long axis was kind of a line, right? Isn't there multiple different ways you can be parallel to a line? Yeah? Okay. So the two that we're going to be interested in is two different longitudinal ones. One of them is called a coronal, as in crown, as in Corona, the beer with the crown on it. Don't pretend just because you're in Utah you ain't never seen a beer before. I know you walk by them and it ain't a sin. Okay, so you walk by, and in Texas, that's just how we make friends. I moved here and I didn't realize that when you move to Provo, you do not invite your neighbors over for margaritas to make friends. Because all of a sudden my kids couldn't play with anybody. I'm like, WTF, I hate this place, I'm moving to Salt Lake. And I did, don't think I didn't. Okay. And I make bomb-ass margaritas. That's actually what they're called, bomb-ass margaritas. Because like it's part of Texas culture. You're like, can't leave the state without making an amazing margarita. Okay, you might make better margaritas. Do you make better margaritas than I do?
Yeah, I'll do.
Well, he's a chef, so. Okay. I wish we could have a contest, but I know I'd get fired. Okay. So this type of plane of section, sorry, we'll do this one first. This one right here is called coronal. And coronal divides the body into blank and blank parts. Anterior, posterior, or give me another reasonable pair, ventral and dorsal parts. Either one of those will work, right? Okay. So this is called a coronal section. Why would we use a coronal section? Well, sometimes that's the best type of section to see things. So for instance, if I wanted to look at the human heart and I wanted to see all four chambers at the same time, wouldn't that be a good type of section to do? Yeah? And FYI, when you read your anatomy book, it will say human heart, comma, anterior view, comma, coronal section, right? So you know exactly what you're looking for, or what you're looking at. So that's coronal section, okay? Now, since you don't have a midline, this way you don't, do you? Because you don't have any paired structures, anterior and posterior. There's no such thing as a mid-coronal section. But you can have serial coronal sections, like I could have it that went through my eyeballs and went through here. And obviously with imaging software, you can do a coronal section anywhere you damn well please, right? Okay, so that's a coronal section. The next type of section is this one that's in pink. That's called a sagittal section. Everybody misspells that one, so I'll just go ahead and tell you 1 G, 2 T's. Okay, sagittal section. Sagittal section divides the body into what and what parts? Left and right parts. But we do have a midline there. So you can hit the midline or go distinctly off of it. So let's talk about that. So sagittal is just a general term first, and it means I'm dividing it into left and right parts. But if it is an organ with bilateral symmetry, you can divide it into equal left and right parts or unequal left and right parts. Got it? Okay. So both of these are sagittal, yes, but this one is mid-sagittal, which is more specific. Equal left and right parts. This one is parasagittal, which is decidedly unequal left and right parts. Yeah? So which one do you use? So here's my first time, but not my last time to tell you that in anatomy, if there is a more specific answer, the general answer is wrong. And why is that? Well, because you're going to freaking kill me, right? I want you to keep me alive by knowing exactly what you're talking about and being super specific about it, right? So if I showed you this specific image, and you could see it really well, or this one down here that you can see, this is using imaging techniques. That's not a sagittal section, that's a mid-sagittal section. It's going straight through the middle of the brain, straight through the nose, right? But if I had a section that went through my eye, it would be a parasagittal section. Parasagittal section. Now, do all organs have a mid-sagittal? No, because they're not all really symmetrical. So if I did a sagittal section through my left lung, there isn't a mid-sagittal or parasagittal because it's really not symmetrical, right? But the body is, right? Okay, so that is sagittal, mid-sagittal, and parasagittal. Okay, and then transverse or horizontal plane of section is next. And the transverse or horizontal plane of section is basically dividing whatever it is into top and bottom, or superior and inferior, or give me another set of terms. Cranial and caudal. Yeah, of course. Does that make sense? Okay, so sometimes those are called cross sections. Cross sections, yeah? So a transverse section or a cross section, and you can see one right here. We don't have mid-transverse because we're not mirror image top and bottom either, right? So you can do serial transverse sections. And if you wanted to see, for instance, with the human heart, the difference in thickness between the left ventricle and the right ventricle, then a coronal section might not be as good as a transverse section through the ventricles. Does that make sense? So depending on what you're looking for, what kind of section you do. Everybody good with that? Okay. So there is one other kind of section, but it's usually an accident, and that one is oblique. So, by the way, transverse, perpendicular to the long axis of the body, right? For those of you who are not native English speakers, perpendicular is 90 degrees. For those of you who are native English speakers, you should know that damn word. You know you should, right? Perpendicular, okay? Somebody, they're like, what is that word? I'm like, dude, did you fail geometry? Did you fail it? Because you should have. Okay, so this is perpendicular. So the other one is an oblique plane that produces an oblique section. Those are usually accidents. Like sometimes I tried to get parallel, and I didn't quite get it, and I got it at an angle. So it ends up neither parallel nor perpendicular, but something kind of in between. So they're sometimes difficult to interpret, and they're usually accidents, but they do occur. Like if I had a super duper curvy tube, right, and I took one slice through it, can you imagine that I might get a longitudinal section, a cross section, and an oblique section in the same thing, right? So they're kind of incidental. So make sure that you can picture what should happen to a tube. And this is very easy for those of you who are very good spatial imagers. One of the things I have figured out is one of the limits of my intellect is that I have very, very bad 3D imaging. I just can't figure out what the hell is around the corner, or what the structure would look like if you rotated it 270 degrees. I literally didn't even know that people could do that. Like, that seems like a superpower to me. So my husband, he always scores 2 points higher on every IQ test because of that, and I think it's complete BS. Because I know like 7,000 more words, but he can like take this structure that looks like this and rotate it 270 degrees. I'm like, I know you can do that. So this is for the rest of us. I want you to imagine a tube, human esophagus. I want you to imagine that I really, really want to look at the tissue that is lining the human esophagus. For instance, I went in for acid reflux. I needed to know whether the damage had occurred to the lining of the esophagus, which it does with acid reflux. You guys with me? Okay. And what they are going to do is a histology slide. So let's imagine that they took out the whole damn esophagus. That is not the treatment for acid reflux. Just go with me for a minute. Okay, so whole damn esophagus, don't do that. So I want to do 3 different sections of the same tube, and I want to be able to find the same tissue on all 3 sections, right? Longitudinal section, transverse section, oblique section. What am I looking for on the slide? What am I actually looking for? What shape am I looking for? Let's do the easy one first. If I did a transverse or cross section, what shape would I be looking for? Because there's a bunch of distracting crap on the slide always, right? What shape am I looking for? I'm looking for a circle, right? Super easy. Ooh, I'm so mad. Just checked all those damn things. Okay, so I'm looking for a circle, yes? If the esophagus is empty, this is going to be bright white, right? Bright white, that's called. What's that called? That's called the lumen, okay? There's going to be a bunch of distracting other tissue here, but what I'm going to be looking for is the tissue that's actually lining that circle. And that's super easy, and it's actually stratified squamous epithelium, for those of you who started on histology. For those of you who haven't, you'll learn that later. But I don't always do that kind of section. What if I did a longitudinal section? What am I going to look for on the slide? There's a bunch of crap on the slide. How do I find the esophagus on the slide if I do a longitudinal section? What shape am I looking for? Yeah, say again. I'm actually looking for two parallel lines, because you know histology slides are super thin, right? So I'm going to be looking for two parallel lines, yes? Tissues right here, a bunch of crap I don't care about here, bright white lumen here. And you have no idea how useful it is to be able to, with histology slides, know what not to look at. Like, I'm not interested in anything that is not a tube, right? And this is a longitudinal section. And then, of course, the other thing is that sometimes you don't get parallel or perpendicular. You get an oblique section. So what's an oblique section going to look like? Yeah, it's going to look like an oval. Exactly. Okay. Now, here's the thing. Some people memorize histology slides and they think, oh, simple squamous epithelium looks like this, and they're only looking for a circle. That's not what simple squamous epithelium looks like. It looks like all three of those things, and they're all three fair ways to ask you, or stratified squamous epithelium. So you need to be able to sort of transfer that 3D image, but I'm just looking at the inside of a tube, to another view of the inside of the same tube. And for some of you guys, that's easy. For others, it's like, I don't know what the hell you're talking about. But you'll get it. Okay, so now we will move to body cavities. Okay, so body cavities, let me show you what we're talking about. I was never exposed to this until anatomy, but here we are. Okay, so I've got a bunch of squishy organs. The vast majority of them are right here, right? From here to here. But I also have a couple of really important ones right back here, right? Okay. If you have a squishy organ, you have to have a place to put it, and that place is called a body cavity. And so let's talk about the body cavities and figure out how to understand them. I'll give you a little bit more information about why some things are cavities and others aren't in just a second. First off, there's a big subdivision between body cavities. You have all of these that are here, and you have these that are here. Now on me, it doesn't look like these are dorsal, but now I want you to think about my dog and think about the location of my brain and my spinal cord. Those are distinctly dorsal structures, right? Okay, so the ones on the back side are considered the dorsal body cavity. Some textbooks also call it the posterior aspect. You can call it either. I like dorsal body cavity because we have a ventral one, right? And I like the parallel. You can call it posterior aspect if you want to. I won't call it that. I will certainly count it right if you do. So the body cavity that contains the brain and the spinal cord is considered the posterior aspect or the dorsal body cavity, but it has a subdivision. And the subdivision really occurs at the foramen magnum right there, okay? So the body cavity, to be more specific, that contains the brain is called the cranial cavity. And the body cavity that contains the spinal cord is called the spinal or vertebral body cavity. Does that make sense? And either one is fine, spinal or vertebral. So how do you use these terms? Well, again, if there's a more specific answer, use that one. So if I asked you which body cavity contains the brain, the answer is what? Cranial cavity, right? But if I ask you which body cavity contains the brain and the spinal cord, what is it? Dorsal body cavity or posterior aspect, right? So if you are using a general term, make sure I'm sort of pulling it out of you kicking and screaming, right? There's no other right answer, okay? Cool. And these are kind of special. The cranial and vertebral cavities, they have special membranes associated with them because the nervous system is really, really sequestered from the rest of the body. So we won't do a whole lot more on those today, and we're going to focus more of our time on the ventral body cavity. And the ventral body cavity is from here to here, right? And the ventral body cavity has a lot of subdivisions. So I want to kind of make sure that you understand the structural subdivisions of the ventral body cavity. So if we're doing the ventral body cavity, there's one big subdivision, and the big subdivision occurs pretty obvious and immediately, is that there's a big bell-shaped muscle right here that divides everything up here from everything down there. What's this muscle called? Yeah, that's the diaphragm, okay? Everything above the diaphragm is the thoracic cavity, yeah, and everything below is the abdominopelvic cavity, okay? But they both have further subdivisions, and the thoracic is a little hard to understand, so I want to make sure that you actually follow what's going on with it. So let's do thoracic first, okay? Everything up there is the thoracic body cavity, but it has subdivisions and it has more cavities within the cavity. So let's do that first. Let's draw. Okay, here's the diaphragm. Above the diaphragm, this is all called what? Yeah. Okay, but the thoracic cavity has further subdivisions. So what we are going to have, you'll understand this a little bit more after we do serous membranes, but what we are going to have is there is going to be a cavity over here that contains my right lung, and it's going to be called my right pleural, Pleural cavity. Contains my right lung, okay? And it's going to be separate than this one, which is my left pleural cavity that contains my left lung. You with me? Now, it's important that those two are in separate cavities. It's the reason, by the way, that you can collapse the one lung and the other one still works, and we'll talk about that in more detail as we actually get into it. So this is a whole cavity. These are cavities within it, okay, and they're sequestered. But before I go any further, I want to show you what is between those two. So do you see the space between these two pleural cavities right here? Here, it's only represented in yellow up there as the mediastinum, but I want to show you that actually the mediastinum, we're going to put the heart in a minute, but I want you to see the mediastinum before we do. This space between the two pleural cavities is called the mediastinum. Can you say that, please? Mediastinum. I do that not to torture you, but because if you can say it, you can usually spell it, okay? The mediastinum is not actually a cavity. It's a space between the two pleural cavities. Why the hell do you care? Well, because it's got the trachea running through there and the esophagus running through there and some big blood vessels running through there, and that's all in there, in that space between the two pleural cavities. And it's all in there before you put the heart in there, okay? So now we're going to stick the heart in there, and the heart goes on top of all of those structures that were already in the mediastinum. So now we put the heart in its own cavity called the pericardial cavity. Good? Okay. All right, so let's pick this apart a little bit. Which of these two statements is true? Which of these two statements is true? The mediastinum contains the pericardial cavity, that's A, or the pericardial cavity contains the mediastinum. A is true. Yes? Does that make sense? So it is within this space called the mediastinum. Does that make sense to you? Okay. So the mediastinum is the space between the two lungs, and then you actually stick the heart in there in the pericardial cavity. What I mean is, really, when you open up a body or a patient and you crack the ribs and open it up, behind the fat, you're going to see the heart in its pericardial cavity, and you are not going to see the trachea and the esophagus unless you move it out of the way. All that stuff's behind it. Okay? Good? Okay. So that is the thoracic cavity. Now, that said, now we have to be super specific. And so if I asked you, and I will, which body cavity contains the right lung, will I give you all of these choices? Will I put ventral? Will I put thoracic? Will I put mediastinum? Will I put right pleural and left pleural? Yeah, I'll put all of them. And there's only one correct answer. And what is it? It's right pleural cavity. Yeah, good. So I will always give you the general answers that would distract the student who didn't study enough, right? Because my multiple choice questions will always have a bunch of reasonable answers, but only one right one, right? a bunch of distractors, and it's not pericardial cavity, Donald Duck, and 4, right? That's not what the multiple choice answers look like. Go ahead.
So when people, when you tell people have fluid around their heart, is it pericardial cavity?
Yeah, it's in the well, there's actually a sac. Hold on to that question. I'll come back to it and we'll address it more completely as soon as I teach you about the sac and how it's actually formed. But yes, I'll come back to that. And you can have fluid around your lungs too. Everybody good? Everybody good so far with that? Okay, all right. So now let's go below the diaphragm and do this body cavity. The whole body cavity from here down is called the abdominopelvic cavity. And the abdominopelvic cavity, of course, has all your digestive organs except your esophagus in it, right? It's got pretty much all of that kind of stuff. Reproductive organs are in here and a little bit in here, okay? And some of them are external, but those aren't in the body cavity. So there is, in humans, no longer a membrane that divides the abdominal from the pelvic, but there still is in a lot of mammals, but not in us. So how do you know when you're in the pelvic cavity in humans? You use a structural landmark, which is your anterior superior iliac spines, which are those bones that hopefully you can still feel. I could feel them better a few years ago, but I can still feel them in there. Those guys right there, draw a line. Everything below that would be in the pelvic cavity. Everything above is in the abdominal cavity. So what's really a super dependable organ to say it exists in the pelvic cavity? Yeah, the urinary bladder, right? Even your ovaries, ladies, are like above it the vast majority of the time. And your uterus is above your urinary bladder. If you have been pregnant, you know that, right? It smashes it down against your pubic bone. It makes you have to pee every time you get like 2 drops in your bladder. So pelvic is pretty small. Abdominal is pretty big. So what's in the abdominal cavity? Well, damn near everything, right? You don't even have to know very much about anatomy for me to say which body cavity contains the stomach. Abdominal. And which body cavity contains the urinary bladder? Pelvic, right? Later on, you'll know a lot more organs, so I can make the questions harder. But for right now, I think everybody knows that the stomach is not down there. Do you not? If you don't, you probably should. Okay. All right, so that's the abdominal and the pelvic cavity. So now we're going to be able to address, well, actually one more thing, and then we'll address her question. Okay, so animal behavior and human behavior. Which organs? The organs in the ventral body cavity or the organs in the dorsal body cavity? Which of those are more vulnerable? Ventral. And why? Because there's far less bone around it. Even the ribs have spaces between them. And so does that have any impact on animal behavior? When an animal is feeling physically threatened, what do they often do? Yeah, they curl into fetal position. It's not because they don't like their brain, because it's literally your favorite organ, because it's the organ that has favorites, and it shows itself. It's like, I'm the coolest organ, fight, right? And ain't nobody gonna fight the brain. So you curl into fetal position. Interestingly, humans even do that with emotional stresses, right? If you have never had enough emotional stress that you have curled into a fetal position, I don't even understand your life. It happens on like a monthly basis, and I'm just under the covers, and my husband is sticking champagne and chocolate under there and Netflix until I come out. And then, so yeah, that's how our marriage works. Okay, so it does have an impact on animal behavior. So now let's get to her question. Will you remind me 5 minutes before class ends so that I can get the rest of the videos for everybody else? Okay, so I'll stop for just a second and tell you what's going to happen. Half of the class was here really early, so here's how I'm going to get to know your name and why I'm torturing you in this way. If I know who you are and I can call you by name instead of just hey you, it makes it more likely that you'll be successful and stick with this class, which is ultimately my objective. So I want you guys to feel like this is a place for you, and how I do that is you are going to sit in front of my phone, and you are going to tell me your name, what you like to be called, something memorable about you, or something important to you, or you're going to tell me a joke. And I'm going to remember that thing about you, and that is how I'm going to know whether you're here every time, and that will matter. It will matter to all of us. Okay, so that's what's going to happen when we're leaving. I will set this up right here with my phone, and then you'll say that, and then I'll try to know your name by this time next week. Okay. All right, so serous membranes. Okay, so here's the deal in the ventral body cavity. let me tell you about the membranes that are lining the cavities and the organs. This is not the same in the dorsal body cavity because they have their own special way of doing it. But in the ventral body cavity, so what I want you to imagine is this is any cavity. It could be pericardial, it could be pleural, I don't know what it is. And this is any organ, okay? And I want to describe the way that a membrane coats and lubricates that body wall and that organ. Okay, so they're called serous membranes. Serous means watery. These organs in this body cavity, the whole ventral body cavity, especially think about the lungs and the heart, they're wiggly, right? Okay, and if you are wiggly and you don't have lubrication, then you have friction. And if you have friction, you can accumulate damage, right? So what we need is we need protection and lubrication. So the way that that occurs is with what we call a serous membrane. And the serous membrane does this. It wraps, it's stuck to it, but I'm drawing it just a little bit away so you can see. It wraps the wall of the body cavity, okay? And then it folds down and it wraps around the organ. And the whole blasted thing secretes a lubricating fluid, right? So can you see that regardless of how much that organ wiggles, as long as the serous membrane is doing its job, it's not going to have a lot of friction, right? Think about how important that is for a lung smashing up against the wall of the body cavity as it inflates and deflates. If it doesn't, it's not actually lubricated, then you get friction and damage to the lung, right? And I'll teach you about a couple of disorders related to that. So this whole thing is one continuous sheet. Kind of think about it like a sheet of saran wrap, right? You know that pink saran wrap that you use at Christmas time, right? So imagine you've got like the most precious cookie in the history of cookies, right? And because this damn cookie is so precious, you are going to wrap the Pyrex dish with saran wrap, right? You're going to take the same continuous sheet and you are going to wrap the cookie. It's a super special cookie, right? And then you stick it in there. How many layers of saran wrap are there between the cookie and the dish? There's 2, yeah, 2. And it's nice and lubricated and the cookie's going to be really protected. So with that in mind, this is a serous membrane. So let's name the portions of the serous membrane. Depending on what the serous membrane is touching, it gets a different descriptor. This serous membrane is touching the organ. It actually just looks like the surface of the organ. I don't know if you've ever skinned anything. I know he has. But if you've ever skinned anything, if you open up and look at the organs, they're shiny, aren't they? Right? And I'm not talking about blood. I'm just talking about the actual organ is shiny. Why is it shiny? It is shiny because you are actually seeing the serous membrane that is lubricated on the surface. It's really thin and it's clear. It is called the visceral portion. If it's on the organ, visceral means guts, like eviscerate, yeah? And then the portion that is stuck to the wall is called the parietal portion. It's one sheet, but you describe it different ways depending on where it is. Can you say parietal, please? Parietal. Okay, and then there's one little portion right here that's neither visceral nor parietal, right? This little, do you see that little portion right there? That's not visceral or parietal, is it? Okay, that actually is called mesentery, and it's really good for stabilizing the organ within the body cavity, right? It's also a really good place to run some blood vessels and nerves through there. So that's how they usually get arteries and veins to and from. Okay, so visceral and parietal. So let me give you an example and then we'll do some specifics. Okay, so what I mean is if I cut myself open and touch the anterior surface of my liver, I'm touching a serous membrane, right? Which one? Visceral, the visceral portion of the serous membrane. But if I cut myself open, flate it open, and touch the anterior body wall that was in front of my liver, I'm touching the parietal portion. Okay, so these are adjectives, and they need nouns. So now let's talk about the nouns that go with those. The nouns that go with those have to do with which body cavity you're in. You with me? Okay, so let's make this a lung. Okay, let's just say that's a lung. Okay, if that is a lung, then I opened it up, and let's say it's the right lung. Open it up, touch the anterior surface of the right lung. I am touching visceral what? Pleura. Yeah, visceral pleura, because that's the name of the sheet that surrounds the lung, right? Visceral pleura, specifically, pleura is the name. Okay, but if I open it up and I touch the wall that is surrounding the right lung, then I am touching parietal what? Parietal pleura. Does that make sense to you? Parietal pleura? Okay, I'll show you pictures in just a second. Okay, now let's do a different organ. Let's do the heart. Okay, so now let's say instead of this being the lung, this is the heart. Okay, open it up, open the sac surrounding the heart, touch the anterior wall of the heart itself, the organ. I am touching what? Visceral or parietal? Visceral. And visceral what? Pericardium. Okay, let's address this really quickly. You know that spelling counts, especially in lab. It doesn't count so much that you can't pass without it, but it does count that enough that it is encouraging you to do so. So, pericardial cavity, because this is an adjective, pericardial. With me? Okay. Visceral pericardium. This is a noun. Okay. Same thing with pleura and plural. Does that make sense? Okay. So it takes a little practice, but you guys can totally do it. Okay. One last place is peritoneum. So the bottom portion right here. Okay. So let's look at these two real quick, and then we'll do the bottom portion. So what am I touching right here? Visceral, left what? Visceral pleura, yes? And if I'm touching right here, I'm touching left parietal pleura, right? Okay. You can do the same thing with the heart. If I'm touching the inner wall right here that surrounds the heart, I am touching what? Parietal. I'm not touching the heart itself, I'm touching the wall that surrounds the heart. Parietal pericardium or visceral pericardium. Okay, so each of these has its own individual sheet, right? Okay, the left and the right one. Let's go back to, you can collapse a lung. One of the things that having a separate cavity does is allows you to maintain basically a vacuum in there that keeps the lung inflated. If you puncture that, the lung will collapse because it's really elastic, but only one of them will collapse, right? Does anybody know how they actually fix that? It's called the pneumothorax. How do they fix a pneumothorax? Put a chest tube, and what does it do? Sucks it out, makes a vacuum again, plugs the hole, right? Okay, so now let's go here. Do you see that the aqua color here is one big freaking one sheet? Yes? It's all one sheet that wraps the entire area down there. Most of the abdominopelvic organs are wrapped in this sheet. And what do I mean it's one sheet? Well, this is our precious cookie, right? Wrapped all around in this stuff, all the way around. So that whole sheet, the whole sheet that is in the abdominopelvic cavity is called peritoneum. Peritoneum. Can you say that, please? Peritoneum. Okay, so now I want you to look at the liver, which is right below the diaphragm up there. And I'm going to name this the liver now, okay? Instead of the other one, okay? So if I touch the surface of the liver, visceral or parietal? Visceral. Visceral what? Peritoneum. And again, if I touch the body wall and not an organ, I am touching visceral or parietal? Parietal. Parietal what? Peritoneum. Good? Okay. Okay, so that whole sheet is called peritoneum. Okay, so one last thing and then I will address her question. So what ends up happening is because there's such a big space in the abdominopelvic cavity, we end up getting one extra cavity, but it's kind of counterintuitive, so I want you to look at this. Notice how little space there is between the lungs and the wall, right? And how little space there is between the heart and the wall, right? But notice that there's a decent amount of space between the visceral and the parietal peritoneum. Do you see that? It's a big enough space that it actually gets its own name. And its name is the peritoneal cavity. It's all in that light aqua color right here. Yeah, it's the peritoneal cavity. So a logic question for you. What should be in the peritoneal cavity? Just serous fluid on a good day, right? You think anything else ever gets in there? Blood, it's called internal bleeding, bleeding into the peritoneal cavity. Are you going to get any less dead if it's not coming out of your body? No, you're not going to get less dead. You're going to get a distended abdomen, and then you're going to get the same amount of dead, right? So that's called the peritoneal cavity. What if I had an organ projecting into the peritoneal cavity? What do I know has occurred if, for instance, a portion of my small intestine was projecting in there? What happened? Yeah, I've ruptured the serous membrane, and it's going into the peritoneal cavity, right? What if my appendix ruptured? Where would the fluid go? It would go into my peritoneal cavity, right? So this cavity is big enough that it has its own name. And of course, it ends up being really clinically important, especially with abdominal surgeries and abdominal damage. Does that make sense to you guys? Okay, so this is the peritoneal cavity. So now let's put this back together, and I'll give you an A and B choice again. Which of these two statements is true? A or B? A, the abdominopelvic cavity contains the peritoneal cavity, or B, the peritoneal cavity contains the abdominopelvic cavity. A is true. Yes, that's the relationship of those. The abdominopelvic cavity is the whole big cavity, right? And it has both organs in it, and then it's got a space between the organs, between the serous membranes, right? And that's called the peritoneal cavity. Good? Okay, alrighty. So let's go to things going wrong. Okay, so sometimes your serous membranes behave badly because you know every damn thing that could possibly go wrong with the human body has and will again, okay? So hopefully not all in the same body. Did you ask about heart? You asked about the heart. Let's do that one first then. Okay, so pericarditis is what happens when the visceral, parietal, or both pericardium does not produce adequate levels of fluid or produces too much fluid. It's inflammation. Itis is inflammation, right? Inflammation of the pericardium. So pericarditis is when that gets inflamed. How can it respond? What it usually does is it overproduces fluid. It's like, oh, crap, and it overproduces fluid. Why is that bad? The reason it's bad is because the outside of this bag is not stretchy. So if you start to overproduce the fluid, where does the pressure go? Onto the heart, and limits the filling of the heart, which limits the pumping of the heart. Does that make sense? And can that kill you? It totally can, yes. I have a heart problem. One of the complications of one of my heart problems is the predisposition to pericarditis. So anybody know what they do in situations like that? If you don't die, what do? They just drain the excess fluid until the pressure goes down to what it's supposed to do. They plug the hole, take care of it. But that can definitely kill you, right? Pericarditis can definitely kill you. And it's a common complication of open heart surgery. So they're watching for it when you have open heart surgery. Like they're watching the pressure in your pericardial sac. But if you don't know that it's occurring, for instance, I have a heart problem associated with the fact that I had rheumatic fever when I was a kid. And so I have some valve damage and I have an electrical abnormality. And one of the things that does is like, you don't want any more heart problems because you've already got a few. So did you guys know that oral health is one of the biggest predictors of cardiac health other than food and exercise? Because the bacteria that are in your mouth, if they get mobilized into your bloodstream, they love to attack your heart and they will cause pericarditis. And I can't handle pericarditis. So what do I have to do every damn time I go to the dentist? Every time. I have to go on antibiotics every damn time I go to the dentist. And I love getting my teeth cleaned. I just love it. I'm one of those weirdos. I'm like, it feels great. But I have to go on antibiotics, of course, antibiotics. And that's where my 13-year-old son came from. Because what do antibiotics do for people? Yes, they do. And that's where Evan came from. And I knew better. I just thought, well, that doesn't happen to me. But, you know, he's a fantastic little mistake. He's fantastic. Okay, so that's pericarditis. But it can also happen here, yeah, and it can also happen there. And so briefly, I'll tell you guys. So if it happens in the lungs, it's usually because of chronic irritation. Pleurisy is what it's called. A really good way to get that is to smoke or work in a coal mine. okay? Or do both. And then if it occurs here, it's called peritonitis. And it's sometimes a complication of, for instance, appendicitis or an abdominal surgery or something like that. And again, they're usually looking for it. So if you're still in the hospital, it'll probably be cool. If you didn't know it happened, you get a distended abdomen, go into the hospital, they'll figure out that you got a whole bunch of fluid in there, and hopefully it's not blood. Okay, we will stop there for today. I am going to make sure the recording